Hey guys, today we will share with you signs that you may have had COVID-19. Did you have it and not know it? The COVID-19 virus may have been around longer than we originally thought, so people may have had the virus and recovered from it without knowing. Some telltale sign could indicate that you are one of those people. A bad cold. It's not uncommon to get a cold during the winter, but if you had one in late 2019 or early 2020, there is a chance your cold might have actually been COVID-19. One way to know the difference is that COVID-19 can stick around 2 weeks or longer, while a cold typically lasts only a few days. And unlike a cold, COVID could have caused a fever and made it hard for you to breathe. Shortness of breath. This is not typically a symptom of a cold or the flu, but feeling like you can't breathe is common with COVID-19. You may have thought you had bronchitis, which COVID-19 can cause, or it may have felt like anxiety or a panic attack. But with COVID, shortness of breath lasts longer than a panic attack. It also comes with flu-like symptoms. Persistent cough. If you had a dry cough that took a long time to go away, it could have been a symptom of COVID-19. It would have been different from a cough caused by a cold. It would have started mildly, but then got worse during the next 5 to 7 days. Red watery eyes. Throughout the pandemic, we have been told to wash our hands often and avoid touching our face. One reason for this is that COVID-19 can affect your eyes. If you had pinky eye, watering eyes, or blurred vision, it might have been caused by the virus. Heart palpitation or chest pain. COVID-19 can affect your heart too. It can cause it to beat fast or flutter or pound. You may have had tightness in your chest. All of these things can happen even after the virus clears your body. Episodes like this can be noticeable for up to 2 weeks, in mild cases, or for 6 weeks in more serious ones. Extreme fatigue. Feeling really tired is a common symptom of COVID-19. So if you had that kind of extreme fatigue that didn't get better with plenty of sleep, it could have been a sign of the virus. The feeling can come back again days and sometimes weeks later. Loss of smell or taste. If foods and drinks seem to taste different than usual or had no taste, or you were not able to pick up on odors for a couple of weeks, you could have been infected with the virus. Nearly 80% of people who test positive have this issue, and it is usually a sign of mild case. Need to know, get an antibodies test. Antibodies are proteins your body makes to help fight off an infection. The only way to know for certain if you have had COVID-19 is to have your blood tested to see if you have the antibodies that fight the virus. If you do have them, scientists are not sure how well they will protect you from getting it again, but some studies show that people who have those antibodies are less likely to get COVID again. Did you have a variant? This chance to the virus, called a mutation, doesn't seem to affect the symptoms it causes or drastically affect the seriousness of the virus. It looks like the only difference is that the mutation is easier to spread from person to person. The signs of this latest form of COVID-19 are the same as the original, so there is no easy way to know which strain you had. Hopefully you liked the video. Kindly subscribe Chauhan Healthcare. Thanks.